Mabel Jong, and we're at our final interview of the day here at the HCEG Forum in Boston. So pleased to have here Richard Lungen, who is on the board of directors at HCEG. Richard, thanks so much for your time.
You're welcome.
So you've been involved with this organization over quite a number of years, I guess 5 years you were mentioning?
5 years on the board and in and out of this event for over 10.
Oh, fantastic. How have you seen this event change and really the mission of the organization?
Well, first of all, there's a lot of conferences in healthcare. There's emerging conferences, there's historical conferences. This one has been sustaining for basically 30 years. The mission has changed a little bit. It was an original organization based on CIOs and CTOs who were sharing information and experiences. Now it's more of a diverse agenda where you have different topics and trends being discussed versus oriented around technology executives.
Okay.
And I also think the audience has changed and it's become broader too. You have payers, providers, investors, companies, payers. So it's become more of a diverse organization.
Mm-hmm. And do you feel that the content or the information coming out of the meeting has become even more invaluable to the people that come to the event?
I think so. I think the information people walk away from is the type of stuff they probably don't get back at their day job. For example, there's companies here that are within our portfolio, such as reflecting the opioid crisis. They're going to hear firsthand on how companies are dealing with technology and true patient experiences. There's a mergers and acquisition panel where we have strategic investors, financial investors, and an investment banker. Those type of discussions are important to bring back where they could share, I think, with their constituents.
Mm-hmm. Do you find that it's as exclusive a group as it started out to be?
I think the word is it's still intimate by design. We like to keep it roughly 100 or so people. Probably could use a few more people from time to time, but the last thing we want it to be is a giant circus of people who don't have the chance to share information and have an intimate discussion. Mm-hmm. So that's by design so far.
Yeah. I heard from Ferris Taylor earlier that you really start putting together the top 10 list for next year shortly after this meeting is over.
It's actually happening right now over a working lunch.
Oh, fantastic.
They're designing the top 10 for this year or finalizing the top 10, and to your point, they're actually starting to think about what the top 10 will be for next year, which will guide our agenda, which we'll probably start working on probably next week.
Yeah, yeah. 12 months seems actually like a brief moment in time. Is it really enough time to address some of these big issues that are on the list?
Well, unfortunately with healthcare, things take time to change. So 12 months goes by in the blink of an eye. Just selling to health plans, for example, 12 months is a blink of an eye. But with the top 10, there is enough time because I think we have enough intelligence and experience on the board and in the room to forecast where things are going and what really matters to the big health plans and stakeholders. So I think there is enough time.
Mm-hmm. Is there anything that you want to add that we can use for our message to members?
I think the key thing, the message to members would be to get involved, to participate, and to not be bashful about bringing up an idea to change the course of what HCEG is about. I'm involved in a lot of the content and discussions and panels, and everyone's invited and allowed to be a part of it. So get involved, raise your hand, and bring ideas.
All right. Thank you so much for your time, Richard Lungen.
Thank you.
Really appreciate it.
Thank you.